Hi, good evening. It's Nikki from Botanical Health Clinic, and tonight we'll be discussing ADHD and blood sugar. ADHD is often discussed through a behavioral or a neurotransmitter lens, but attention, mood, and cognitive flexibility are also deeply influenced by physiology. In this presentation, we're going to look at ADHD and blood sugar through a neuroendocrine perspective. That means we'll explore how energy regulation, stress physiology, hormones, and glucose metabolism intersect. This is not about blaming food, it's not about replacing medication, and it's not about oversimplifying ADHD into a dietary issue. Instead, we're looking at how metabolic stability interacts with attention and stress systems. For some individuals, small shifts in glucose regulation can feel amplified. When we understand the physiology behind that, we gain options, and options create flexibility. Today, we're looking at ADHD and blood sugar through a neuroendocrine lens. The brain depends on a stable energy supply. Glucose is its primary fuel source. Stress physiology and metabolism are tightly interconnected. For some individuals, even small shifts in energy availability can feel amplified. The brain has an exceptionally high metabolic demand. Regions involved in executive function, including the prefrontal cortex, rely on consistent glucose delivery. When energy delivery fluctuates, focus and cognitive flexibility may feel less stable. This does not mean glucose causes ADHD. It means energy stability supports cognitive function. The HPA axis regulates our stress response. Cortisol plays a role in glucose production and metabolic adaptation. Allostatic load refers to cumulative stress burden over time. Stress influences metabolism, and metabolism influences stress signaling. The relationship is bidirectional. When glucose levels decline, the body activates a counterregulatory response. The sympathetic nervous system increases activity. Epinephrine rises quickly, cortisol increases during sustained dips, and symptoms such as anxiety, irritability, shakiness, or even palpitations are physiological responses, not character flaws. In adults, a common pattern involves a rapid glucose rise followed by a sharp drop. Catecholamines compensate temporarily, leading to alertness. But as that response fades, fatigue may follow. Individuals with higher stress sensitivity may experience this pattern more intensely. Estrogen enhances insulin signaling in multiple tissues. Across the menstrual cycle, hormonal fluctuations influence glucose handling. During the luteal phase, metabolic shifts may occur. In individuals already sensitive to mood changes, glucose variability may feel amplified during this time. In perimenopause, ovarian hormone variability increases. Progesterone changes influence GABA signaling, which modulates the HPA axis. Some research suggests increased stress sensitivity during this transition. Cortisol awakening response may also flatten with age, reflecting altered stress dynamics. So let's look at pediatric brain glucose demand. The developing brain uses more glucose than the adult brain. PET imaging shows peak metabolic activity during childhood, especially in frontal regions responsible for executive function. Energy instability in a metabolically active brain may amplify behavioral variability. Stimulant medications increase dopamine and norepinephrine. Dopamine influences reward and appetite pathways. Randomized trials show appetite suppression and modest weight reduction, particularly early in treatment. For some individuals, irregular intake patterns may contribute to greater glucose variability later in the day. This is not a criticism of medication, it is an acknowledgement that metabolic context matters. Short-term caloric restriction has been shown to increase cortisol concentrations. When the body senses energy deficit, stress pathways activate. Cortisol influences hepatic glucose production. So, for individuals sensitive to stress or glucose shifts, restrictive patterns may amplify instability. And a lot of ADHDers, right? They forget to eat. The goal is not fear, it is awareness of how energy availability interacts with physiology. What we've explored today is not a new diagnosis and it's not a new rule book. It's a reminder that attention regulation does not exist in isolation from metabolism. The brain is energy dependent. Stress physiology and glucose regulation are interconnected. Hormonal transitions can shift metabolic sensitivity. Stimulants influence appetite and intake patterns. And restrictive patterns can cause active stress responses. None of this means blood sugar causes ADHD. It means physiology matters. For some individuals, improving energy stability may reduce symptom insensitivity, improve resilience, or decrease afternoon crashes. For others, the effects may be subtle. The goal is not rigidity. The goal is flexible nervous system supported by stable physiology. When we understand the mechanisms, we move away from blame and towards strategy. Thank you for being here and listening to my perspective.